Good afternoon. I need you to keep attentive for just a little while more, and then we'll end these fabulous 2 days. It's really been a truly inspiring. That's not my shot. That's Anuradha Gupta. I am Geeta Rao Gupta. So if you can find my shot, that would be neat, because I had to show it off. I think the most inspirational part, actually, of the last 2 days, or one of the most inspirational parts, has been the pictures, the photos of all of us as happy 5-year-olds. And so I thought I should end with mine, one, because it's really cute. And second, I just, as a reminder of the happiness we all enjoyed when we were 5 years old. I think it was a good symbol for all of the discussions at this meeting. So the purpose of this session is to hear back very quickly from the breakout groups. Instead of doing what was on the agenda as described, we thought it might be more useful, because the breakout groups were focusing sort of on the actions that need to be taken moving forward, that if we could just have the chairs of each of the breakout groups in 3 short minutes present a quick summary of what was discussed. So I'm going to call on the first one. I understand that Anuradha Gupta had to leave. So Zulfi, Bhutta, if you're here. There are 2 mics, if you can line up the chairs. So I want Zulfi, Anders Nordstrom, Niels Delaire, and Tewodros Melesse to please come up to the microphones. And one by one, if you can quickly give a 3-minute summary. Over to you, Zulfi.
So thank you very much, Geeta. Anuradha did a disappearing act on me and left me with the difficult charge of summarizing what was a fantastic set of interventions from the panel. So we started off with the panel comprising of policymakers, academics, civic society representatives, and innovators representing some of the best advocates around this field. So we started off with a presentation from Brazil, which focused on the importance of innovations to reach the poor, the primacy of focused primary care programs and community change agents in achieving change that had happened in Brazil. We also had 2 extremely interesting interventions from Malawi and Tanzania on how they had achieved what they called universal coverage through looking at systematically the barriers that they tried to address through integration, the role of health surveillance assistance in Malawi, and the importance of system support for providing essential services. But I think we benefited also from the tremendous insight provided by Abhay, who I hope is still in the audience, who talked about how he's sitting in the most deprived parts of India, was able to mobilize and use a model of community health workers to provide home-based newborn care, and also models of home-based pneumonia and treatment for other childhood illnesses. We had Sania and Nishtar from Pakistan talk about the importance of bringing in the private sector through a range of things that needed to be done through policy choices, fundamentally rethinking the paradigm of engagement by bringing in private care providers and the supportive environment which was needed to regulate this. And I was able to chip in with my 2 pennies worth of the importance of going beyond mortality into the importance of linking child development and quality of care issues with survival, and how that was essential in bringing in the community from a demand creation perspective as we moved into our action decade. So that, in summary, Geeta, is what the panel covered. We've benefited from a lot of interventions from the floor, highlighting the importance of innovative models such as those provided by the Aga Khan Development Network, and some very insightful interventions from the Honorable Minister of Health from Bangladesh, who also talked about the real challenge as we move into scaling up and provision of essential services, of not forgetting the importance of urban health, and as you pointed out, bringing in demands for intensive care and other services which are a sine qua non of complex interventions.
Thank you. Thank you very much. Next, let's take the group that discussed empowering mothers, families, and communities, and Tewodros Melesse from the International Planned Parenthood Federation will give the summary.
Thank you. Well, the group, as you rightly said, discussed empowering mothers, families, and communities. We had a diverse group. We had the speaker from Patience Kouamewa from South Africa on peer motherhood. We had Sir Bright Ekweme from Nigeria on social behavior and family planning. We had Siti Masiata Rahama from Indonesia. And we had John Lane, who is an engineer. I think he spoke, you know him earlier. And Tom Davis from Care Development. And the group discussed basically on successful approaches dealing with mothers, families, and communities, social determinants, and communities, behavioral change communication, faith, and family planning. The various aspects which have been, can we maintain still health workers or community health workers which are not paid? How do you integrate them? How do you scale up the different programs which have been initiated? And how do you link sanitation to child survival and the family planning, and faith-based organizations and traditional leaders, how can they hold their governments accountable and mobilize communities? The group stressed the importance of community mobilization and the families and centering the women and the individuals, because governments alone cannot do it, and governments also have to be accountable, and this should be a social accountability framework. Thank you.
Thank you very much. Thank you. The next group was ensuring accountability to deliver results. Anders Nordström, who's the Ambassador of Global Health for the Government of Sweden.
Thank you. Thank you very much. We had a very rich discussion as well. Possibly not speaking so much about accountability, but more delivering for the results and what that means in practice. De facto then talking about accountability. We had 6 people that were passionate about health and results on the panel. We started with a colleague from Ethiopia, talking about what has been done there in terms of ensuring that there is one plan, one budget to ensure transparency and alignment of resources, but also what it actually means that the Prime Minister is actually asking for a report. That means that you have to report and you will be accountable for achieving the results. And also being open to discuss when you are not so successful, what can be done then in terms of improving your performance. Then we had a colleague who works at the Johns Hopkins and a long background in working at the community level, and gave us some good insights in terms of making sure that when you work in communities, having baseline plans, evaluation, the importance here of civil society at the local level to ensure that we are achieving the results and also ensuring accountability. We will move then on to the big and very famous Paulo initiative, which is possibly one of the most famous ones that are really focusing on results and using transparency and accountability as a driver actually to achieve the results on the ground. One thing that came out from John, who is the Secretary General for Rotary International, who was on the panel, was the value of having an independent monitoring board on a quarterly basis, actually reporting back the status of how is it actually going. Then we had a colleague then from the African Development Bank talking about the importance of not just results, but actually achieving even more with the resources you have, value for money, and the importance of involving Minister of Finance. And there's going to be a conference in Tunis now in the beginning of July, where the importance of Minister of Finance, but also the parliamentarians as a critical sort of stakeholders here. So hopefully they will get quite a few heads of the budget committees from parliaments across Africa to participate, an important dimension for accountability and for resources. Then we had WHO talking about the Commission then for Information and Accountability, and Liz Mason actually challenged us to be able now to remember the 10 or 11 indicators, and her message was that what we can remember, that will help us to achieve the results, and that will also help ourselves, holding ourselves and others accountable. The MDGs, good examples. That's a good way of also ensuring accountability. And finally, we had a very passionate panel member then from the Gates Foundation talking about family planning and what we can de facto now learn from Paulo and from other ways of working when it comes to achieving results and also ensuring that we are working on accountability. We had finally discussion around that accountability is not only about data. Accountability is about ensuring that we have an atmosphere where we are working together, we are challenging each other, we're challenging ourselves and holding ourselves accountable, and by doing that, continuing then to deliver better health. Thank you.
Thank you, Anders. Thank you. And then the last group, which was the one on using research and innovation to accelerate progress, we have Alan Guttmacher of the National Institute of Child Health and Development.
Thank you. Niels de Leer was going to do this, but Niels turned to me during it and said that he needed to leave early for a meeting at the White House. And since the only commitment I have left is dinner with my wife, we decided that I could stay. We had a very lively panel. The panel consisted of representatives from NGOs, from government, from the private sector, who had backgrounds in both research and in innovation, and talked about a number of issues: the use of new technologies, the application of proven and sometimes unproven innovations, the role for evidence-based interventions, really the science of implementation, but also at the same time acknowledgement that not everything demands a randomized clinical trial before it should be used. So it was very far-ranging discussion along with the participants. I think there were several main messages that came across at the end. One of the themes really was the importance of in-country involvement, whether it be in terms of designing the innovations and certainly in terms of implementing them, et cetera, that obviously it really needs to have in-country involvement, some discussion about how one builds the in-country infrastructure to be able to do that, et cetera. Closely related to that, the importance of collaboration among governments, funders, other NGOs, the academic sector, the private sector, that to really be effective in terms of both research and innovation based upon research, that it really takes collaboration amongst all of those sectors. That there's need for innovation in many different aspects. There's innovation clearly needed in terms of healthcare delivery, in terms of training of healthcare workers, in terms of patient and individual and community education, and also in terms of research, that we need to think about innovating there as well. I think the theme that I took away at the end, and something that came up a couple of times in terms of sort of an action item really, and I'll end on this, is that the call of, as the group itself proved, I think in the discussion, that the call to action would benefit from a research and innovation arm. And that as it moves forward, we need to think about how do we build research and innovation into it, and in doing that, how do we accomplish that in a way that really does widen the ability of many countries to participate actively in the research and innovation enterprise, not simply as a locale in which to do it, but in true participatory kind of way that all countries should be involved in the research and innovation.
Thank you.